Hello, my name is Joshua Brown from the interview training company howtobecome.com, and in this presentation I will teach you how to pass your operating room nurse interview. So if you have an operating room or theatre nurse interview coming up for any NHS trust or healthcare setting worldwide, then please make sure you watch this video from start to finish, because I'm going to help you to stand out and succeed. To achieve that goal, this is what I'll cover. I'll start off by giving you a list of the most current operating room nurse interview questions that I strongly recommend you prepare for. I'll then provide you with example high-scoring answers to those questions to help you to succeed. Plus, I'll also make sure to give you some essential tips for passing your operating room nurse interview, before finally telling you how you can instantly download these slides plus 27 quick and brilliant answers to operating room nurse interview questions in a PDF guide. And just very quickly, please don't forget to subscribe to my channel, because I want to help you to pass your interview by giving you brilliant answers to the toughest operating room nurse interview questions, and I can only do that if you are subscribed. And please don't forget to hit that like button, because this tells me you find these tutorials useful. Okay, let's take a look at that opening theatre nurse interview question, which is, tell me about yourself. Now this is a brilliant opportunity to get your interview off to a flying start and impress the hiring manager. You can be the standout candidate by focusing your answer on the following things. Number one, the skills and qualities you have. Do not talk about your home life or your personal life unless it's relevant to the job role itself. Instead, focus on your experience and your passion for working in the job role itself, and how you're going to add value to their healthcare organisation. A great way to do all of those things and give yourself the best chance for passing your interview is to make sure you study the job description and focus on telling the hiring manager or interview panel how your skills perfectly align with those skills and attributes that they are after, those skills and attributes that they list on that job description. That job description is your blueprint for success. So for example, if on the job description it states they're seeking someone who is great with communication and is patient-centered and analytical, then throughout your operating room nurse interview answers, be sure to use those exact terms and back it up with evidence of where you've previously demonstrated them. Let's take a look at a brilliant top-scoring answer that's going to make you the standout candidate. Tell me about yourself. I'm a dedicated and compassionate theatre nurse with over 5 years of experience in fast-paced surgical environments. My journey in nursing began with a strong desire to make a tangible difference in people's lives, which led me to specialise in perioperative care. I thrive in team settings and am known for my ability to stay calm and focused under pressure, ensuring the highest standards of patient care. I've had the opportunity to work in various surgical departments, handling both elective and emergency procedures, which has honed my adaptability and problem-solving skills. Beyond clinical expertise, I actively engage in continuous learning to stay abreast of the latest in surgical nursing. I'm also passionate about mentoring new nurses, as I believe in fostering a supportive and educational environment for all team members. My goal is to contribute my skills and positive attitude to your team, enhancing patient care and surgical outcomes. Wow, what a brilliant way to kickstart your interview and be that standout candidate. Remember, by giving a confident answer like this to that opening interview question, which may be phrased as introduce yourself, not only will you impress the hiring manager, but you'll also gain confidence in the rest of your answers to come. Okay, let's take a look at the next operating room nurse interview question, which is, why do you want to work in the OR? Now, you're being asked this interview question because they want to understand your motivation and your passion for working in a high-pressure surgical environment. So when you answer this interview question, make sure you emphasize your fascination with precision, teamwork, and patient care. And also make sure you highlight your desire to contribute to saving lives and improving health outcomes through your role in the operating room. So as a theatre nurse, that is so important. Let's take a look at another brilliant top-scoring answer to help you. Why do you want to work in the OR? The operating room fascinates me because it's where precision, teamwork, and critical thinking converge to save lives and improve health outcomes. My passion for perioperative nursing stems from the unique challenges and the opportunity to be part of a team that directly impacts patient recovery. I find the fast-paced, detail-oriented nature of OR work exhilarating, and I thrive in environments where clear communication and collaboration are key. Moreover, I'm deeply committed to patient advocacy and safety, and the OR offers a platform to practice this daily. Being in an environment where I can continuously learn and adapt to new technologies and surgical techniques is incredibly motivating. I am eager to bring my skills and enthusiasm to your team, contributing to a high standard of care and positive patient experiences. Okay, don't go anywhere as I still have plenty more interview questions and answers to give you, but when you're ready, and only if you want to, please click that link in the top right hand corner or in the pinned comment below this video. It will take you through to my website, howtobecome.com, where you can download my 27 operating room nurse interview questions and answers for all healthcare organisations to give you the edge in your interview, including the ones we're covering right now. Okay, here is the next theatre nurse interview question. Describe a time when you've worked well in fast-paced environments. So the interview question here is being asked to assess your ability to handle high-pressure situations in the OR. So a top tip for answering this interview question is to use the STAR method, which stands for situation, task, action, and result. You can use this to structure your answer. So you start with a structured response highlighting a specific example that demonstrates your skills in a fast-paced healthcare setting. So what you need to do is to provide a clear and structured response highlighting a specific example that demonstrates your skills in a fast-paced healthcare setting. So using the STAR method, you start with the situation you faced, the task that needed to be carried out, then you talk about the action you took to achieve the task, and then finally the result following your actions. Make sure it's always a positive outcome, a positive end result. So let's take a look at a top scoring answer using the STAR method to structure our response. Describe a time when you've worked well in a fast-paced environment. In my previous role as a theatre nurse, I recall a day when we had an unexpected influx of emergency cases. I was part of a team handling a complex surgery when we received word of multiple critical patients arriving. Despite the high pressure situation, I maintained composure and efficiency. I quickly coordinated with the team to ensure a current surgery was completed safely while preparing for the incoming cases. My ability to anticipate the surgeon's needs and swiftly organise the required instruments and equipment was crucial. After our surgery, I assisted in triaging and preparing the OR for the subsequent emergencies. This experience highlighted my ability to remain focused and effective in a fast-paced environment. My proactive approach and clear communication ensured smooth transitions between surgeries, ultimately contributing to successful patient outcomes. Okay, here is the next theatre nurse interview question. How would you react if you saw there was something wrong with the patient's vital signs during surgery? Now, you're being asked this interview question because they want to evaluate your ability to respond effectively to critical and high pressure situations in the operating room, ensuring patient safety and well-being. Now, a brilliant tip here for answering this interview question is to emphasise the importance of remaining calm, promptly alerting the surgical team, and preparing for potential interventions while maintaining a sterile environment and clear communication. Here is a brilliant top scoring answer to help you. How would you react if you saw there was something wrong with the patient's vital signs during surgery? If I observed an anomaly in the patient's vital signs during surgery, my first action would be to remain calm and alert the surgeon and anesthesiologist immediately. It's crucial to communicate clearly and promptly in such situations. I would ensure that I accurately report the specific changes observed. Simultaneously, I would prepare for potential interventions, like getting necessary equipment or medications ready, based on the team's decision. My focus would be on maintaining a sterile environment while assisting the team in stabilising the patient. Having worked in high-pressure situations, I understand the importance of quick thinking and teamwork in these critical moments. My priority is always patient safety, and I'm committed to responding effectively and efficiently to any changes in a patient's conditions. Okay, let's move on to another OR interview question. This one is really important. If you had to prepare for an operation you didn't have experience with, what would you do to prepare? Now, why are you being asked this interview question? Well, you're being asked this interview question and it's a real challenging one because they need to assess your ability to handle critical situations and communicate effectively in high stress environments such as that of the role of a theatre nurse. So a top tip here is to emphasise a calm and proactive response, focusing on immediate communication with the surgical team and preparedness for potential interventions while maintaining patient safety and a sterile environment. So here's a brilliant top scoring answer to help you. If you had to prepare for an operation you didn't have experience with, what would you do? In situations where I'm faced with an unfamiliar operation, my approach is proactive and thorough. Firstly, I would review the surgery protocol and any specific procedures or equipment involved. I believe in leveraging available resources, so I'd consult with more experienced colleagues or the surgeon to gain insights into the specific nuances of the operation. Additionally, I would research the latest best practices and guidelines related to the surgery. Hands-on preparation is also key. I would familiarise myself with any special instruments or technology that will be used. This preparation not only ensures I'm ready, but also helps maintain a safe and efficient operating room environment. I'm a firm believer in continuous learning and adaptability as a theatre nurse, and preparing diligently for new experiences is an integral part of providing the best patient care. So the next thing to do if you want to get the full list of 27 operating room nurse interview questions, and if you want to accelerate your learning even further to pass your interview at the first attempt, is to click that link right now in the top right hand corner of this video for two reasons. The first reason is it will take you through to my website, howtobecome.com, where you can get all of these answers we just covered, plus a total of 27 brilliant responses to operating room nurse interview questions. And secondly, the next reason is I've given you 3 smart questions to ask at the end of your operating room nurse interview on that page. It's a brilliant resource guaranteed to help you prepare effectively for your interview and also, more importantly, put you ahead of the competition. Make sure you check out that link. I hope you've enjoyed this tutorial. Please don't forget to subscribe as I'm on a mission to help as many people as possible pass their job interviews, and I can only do that if you are subscribed. Please also hit that like button as that encourages me to make more videos just like these ones. And if you have any questions regarding any specific healthcare organisation or role, do let me know in the comment section below, where I'll get back to you with even more interview tips and advice. And finally, don't forget to connect with me on LinkedIn. I've put my LinkedIn link in the description below. It's always great to connect with like-minded professionals such as yourself. Thank you so much for watching. I wish you all the best with your interview. Have a brilliant day.